The COVID-19 pandemic was highlighted numerous aspects, obviously, of our healthcare system that needs improvements. One of them that we all recognize is the disparities America's living in rural health areas, facing our rural health areas. But addressing health infrastructure in rural areas is a serious concern, and as I said, one of my top priorities. And while the CDC has undertaken efforts to address that, there's no entity within the CDC tasked specifically with this work, and that's concerning to me. I believe establishing a new Office of Rural Health within the Center of Disease Control would be an important way to support rural communities through the end of this pandemic, and to prepare for any other future public health crisis that we could be faced with. And, I just envision this office to be empowered to look across CDC programs to ensure the work of the agency is properly addressing the health needs of the 57 million Americans who live in rural communities. Director Walensky, how strongly do you support establishing an official Office of Rural Health within the CDC, and how can we work together to get this done if you see that the way that I see this?
Thank you, Senator. As you noted, we have 20% of Americans, 57 million Americans living in rural areas. Part of the deep need for investment in a public health infrastructure is to develop a workforce that looks like the community, that is from these communities, that knows how to access and reach these communities, which is exactly one of the challenges that has occurred during this pandemic, and one of the reasons we had differential distribution of vaccines between rural and non-rural communities. We also know that there are other ways outside of COVID that we learned from COVID, such as telehealth. We had a previous MMWR that demonstrated, ironically, that telehealth was not reaching rural communities. And that is, in fact, one of the areas that we should be using telehealth, in fact. So why was it not reaching the rural communities? CDC is investigating this just by virtue of the fact that they've had several MMWRs in the last 2 weeks examining these issues. So as part of the public health infrastructure, of the disease agnostic infrastructure that works on labs, that works on workforce, that works on data, we are invested in urban communities as well as rural communities.
And I think a lot of that is broadband issues as well that we have to get addressed. But I understand the CDC has a highly categorical manner for providing funding to state health departments, with most funding tightly tied to specific diseases or specific purposes. And I'm concerned that restricting CDC money to specify activities prevents states from being able to address issues that vary from state to state, because all of them are different, and it makes it difficult to respond efficiently to emergent challenges like COVID-19. And I've always been big on flexibility, because the states really know where their needs are, and I believe greater flexibility on funding might allow states to better target resources. So I just wanted to mention that to you, of the flexibility there, that we sure saw that our hands were tied in some cases during COVID. So I just wanted to address that with you.
I would just echo your thoughts and say, yes, one of the things that has been challenging for us at CDC is line items that have to go to X or Y, when in fact what we need is the infrastructure, the disease agnostic infrastructure, so that when we see this community needs this, but they may both need to establish a lab, but one needs broadband and the other needs a genomic sequencer, that it's flexible enough to be able to make sure that each of the communities can scale up for what they need. Absolutely.
Thank you. That's very encouraging. Thank you.